Melinda didn't die when she overdosed. Nala didn't contract HIV when she injected heroin. And Tony did not expose himself to the risks of polydrug use and its consequences. All of them survived because harm reduction saved their lives. Harm Reduction International, a leading NGO in this field, refers to harm reduction as policies, programs and practices that aim at minimizing negative health, social and legal impacts associated with drug use, drug policies and drug laws. The very idea of harm reduction is grounded in social justice and a human rights-based approach to health. Drug use or drug dependence do not waive people's right to receive equal access to treatment and healthcare. Drug dependence is not a choice, and as such, it is recognized as a chronic medical condition by the World Health Organization. Harm reduction transforms this understanding into a pragmatic approach aimed at improving public health and public safety. Melinda didn't die when she overdosed with opioids because a social worker in the drug consumption room she was in recognized the symptoms and gave her the opioid antagonist naloxone. Nala didn't contract HIV when she injected heroin because she used sterile equipment from a local needle and syringe program. Tony now understands the risks related to polydrug use because he had the chance to learn about the harmful consequences. The concept of harm reduction emerged in the early 1990s as a pragmatic response to the rapid increase of drug use-related transmissions of blood-borne diseases like HIV and hepatitis C. The evidence-based approach has now evolved, and its legal and practical implementation has been rolled out around the world. Studies suggest that more than 80% survive an opioid overdose thanks to the administration of naloxone. Unsafe disposal of drug paraphernalia decreased by 80% in areas close to a drug consumption room. Harm reduction approaches are cost-effective, evidence-based, and have a positive impact on individuals and public health. Therefore, harm reduction measures not only benefit individuals who use drugs or suffer from drug dependency, but also families, communities, and societies. We believe that a multidisciplinary and evidence-based approach is necessary to maintain coherence with regards to health, social justice, and development policies. So the approach of harm reduction incorporates destigmatizing drug use, as well as offering individuals tailored assistance, support services, and treatment, which not only have proven to be cost-efficient, but also effective in mitigating the adverse social and health impacts of drug use and repressive drug policies. The outcome? Melinda is receiving opioid substitution therapy and social support, and can be there for her family again. Nala is still in counselling and also promotes the use of clean injecting materials amongst her peers. Tony informed himself and found useful information on safer drug use, and so avoided harm which could have been caused by polydrug use. By ensuring that harm reduction services are accessible to all people, regardless of age, class, race, gender, education, religion, or cultural background, socioeconomic or personal factors, we can actively help and greatly reduce the negative societal consequences and health-related risks of drug use and drug dependence. Where possible, harm reduction measures should also address vulnerable communities. Services should be aware of the specific needs of women who use drugs, as they are often exposed to even higher discrimination and stigmatization. Harm reduction interventions are a way to invest in the future, in the healthy and safe development of children, young people, families, communities, societies, and entire countries.